like asking any questions, you can ask, you can type it in the chat box. And I would like to have a lively interaction through the chat box so that you will learn very quickly. And also the thing is, most important thing is your participation is most important, because if you want to learn well, you need to participate, right? So it's most important. And we are going to start now. And to start with, I wish you all a very, very, very a prosperous new year, a healthy life from here on. I hope it is. Is it clear and visible there? Is it clear for you? Yes? Okay, great. Is it clear for you? Am I audible there? Am I audible there? Yes, great. So we'll start now. So what we need to understand is, whatever the physicians are treating, whatever we are treating, we treat, but the nature cures. There is an inherent potential within each of us, okay, which is protecting you, gifted from a God, which is protecting you every time, okay? This is what we need to understand. So whatever the medications are giving are actually aiding in internal healing. The healing happens within you, right? So you heal yourself. The most important thing that we play, the role we play is like you provide the right kind of environment and lifestyle and the epigenetic factors to aid in the internal healing. So you heal yourself. So we have to tap that art of internal healing. And today we have started the Golden Heart Initiative for the first time. And there is no such moments like controlling the BP, cholesterol, and heart attacks and strokes so far have been like initiated, because the science is very, 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 very like gray. It's not very clear even as of now. Even if you're like, we are living in a world of advanced technology, right? And in the world of digitalization. But even to this day, the code of cholesterol, heart disease, and strokes, and even BP is not being decoded now by most of the scientific communities. And unless it is decoded, we don't have any answers to it. We can use a lot of drugs and all those things to control the BP, to control the numbers, to reduce the numbers. But the most important thing is there is no solution to it, even as of now, right? So we need to understand what is happening inside the body, and we need to understand the problem. And if you understand the problems, there is a solution towards it. Okay. The very first thing to find a solution is to define the problem, what it is. You need to know a lot of this, the roots of the disease, and then you can treat it very easily, right? So how many of you like practiced all these kinds of healing protocols? And I would like to know that what you believe the root cause of BP, cholesterol, and heart attack. You just type your responses in the chat box so that it will be live interactive session, and you will be busting all those myths behind the heart attacks, strokes, and cholesterol now. Okay. Okay, bad lifestyle is one, epigenetic factor, metabolic syndrome. These are like very vague terms. I just wanted to be very, very specific. Yes, of course, inflammation does plays a role on it. But the most important thing that you need to understand here is like a lot. Okay. Yeah, the root causes inflammation. It is somewhat okay, but not very much crisp and clear here. All these things are contributing factors. Okay, whatever you have like tried, all these things are contributing factors. Even the stress, inflammation, all those things. Yes, of course, it does. Okay, mental health concern. Yes, of course, it does. Insulin resistance, wonderful. And how insulin resistance is going to have an impact is most important, right? So most of us know a term called insulin resistance, But the sad thing is, we don't know what are the root cause of insulin resistance and how it is going to impact the BP, how it is going to impact the cholesterol, and how it is going to impact the heart attacks and strokes. That is the missing link, right? So if we know the missing link, then we can treat it very easily, right? Okay. So no one actually, the BP is actually a sign, it's not a disease. Okay, it's a disorder. It's simply a sign. It's no more a disease. Okay, and no one dies of high blood pressure. No one dies of high blood pressure. So it's like watching a movie called Scanners. In this movie, like there is something like exploding heads, bulging eyes, and popping eardrums, brain seizing. Everything will come in this movie. Like it's a horror movie. If you want, you can watch. And the way we look at hypertension is like we are thinking like if we are having increased BP, then it will like the blood vessels will explode, but it is not. Okay. It will cause heart attacks and strokes suddenly, but there is much more than that to be like understood. So many of you would have not noticed or known that the weightlifters working at like international levels, they are having a BP of around 320 about 250 at their peaks. Okay, whenever they're exercising, strenuous exercises causes this kind of an increase in BP, which means BP by itself cannot cause all those heart attacks and strokes, but rather there is something else that needs to be understood in decoding the cardiovascular diseases. Whenever you're feeling like very at rest, at parasympathetic dominant mode, what happens is like you are at absolute rest, right? So what happens is you don't need that kind of a high blood pressure to keep the system going. And during sleep, the BP can fall like below 90-60, but it is normal. Okay. And whenever you are exchanging words or you are involved in fights, then what happens is your BP will shoot up because of sympathetic dominant mode. And as I'm speaking now in front of audience, my BP tends to go up a little bit because it causes a little bit of sympathetic dominant mode, right? Is it clear for you all? So the rise in BP by itself is not a disease. It's not going to kill you, but rather there are so many things that needs to be understood, and we'll be discussing this. And is it clear for you now? Is it clear for you? Yes? Okay. Great. Type your responses in the chat box. So people have experimented, our scientific community have decoded this. Healthy blood vessels actually do not break. Okay. So if you look at the critical pressures for arterial wall rupture in major human cerebral arteries, it's like way high, okay, than what we think. Okay. And even balloon angioplasties, in balloon angioplasties, they have like they will raise the blood, the pressure levels to almost like a 16 atmospheric pressure to just like open the blockage, which means that the blood pressure by itself is not a problem, but rather there are so many things that needs to be understood. Okay, is it clear for you? So there is another confusion in knowing what is the critical cutoff or a cutoff point for diagnosing a person with hypertension. So how much cutoff threshold is usually followed in knowing who is hypertensive and who is not? Anyone? What is the cutoff you use? It keeps on changing, right? It keeps on changing. The cutoff keeps on changing now and then, is it not? So how much is the cutoff you believe like you usually have? Okay, it keeps changing. Very good. Yes, 140/90 is what you believe is great. Any other answers you have? 135/85, interesting. Anything else? 130/80, that's fine. Anything else? Okay, it keeps on changing. Okay, prior to 1990s and 2000, we have like in the 1990s we have a cutoff of about 160/100, but it has been reduced to 140/90, and nowadays people are even treating like if it is going more than 120/80. Okay, there is a confusion in achieving the concurrence, and the most important thing that we need to understand is the American Heart Association and the American College of Cardiology believe that the BP more than 120/80 is abnormal. Okay, but it is not. Okay, that's why the American College of Physicians and American Association of Family Physicians both decided not to endorse this kind of AHA and ACC guidelines. We firmly believe that no one really needs to be treated with a lot of drugs unless the BP is shooting up like more than 140/90, and even in old age we can take the cutoff to be like 150/90. Okay, when you are having your cutoff at 140/90, 1/3 of the population is suffering from heart disease, I mean hypertension. When you are moving the cutoff to 120/80 or 130/80, what happens is suddenly the half of the population is suffering from hypertension. Okay, and this could be largely influenced by the big pharma industry. It could happen. It could have been happened. But what we need to understand is unless the BP is more than 140/90 or 150/90 in old age, people may not go for drugs, but rather they can involve in a way like all the lifestyle changes that they can bring about a very good improvement in reversing the BP. Is it clear for you? So the ideal cutoff could be like 140/90 and 150/90 in old age. That could be the cutoff like for treatment purpose. But there is no need to worry about all these numbers because we have been seeing at least like 95% success rate in reversing the BP within a span of like 2 to 4 weeks time. Not more than that. Not more than that. Okay. When you know the signs, you can easily handle this BP very, very well. Okay. There is no need to take drugs for lifelong. It's not a chronic disease. It's not a progressive disease when you know the signs. When you don't know the signs, it's a progressive disease. It's a chronic disease. Is it clear for you? Is it clear for you all? Great. So what we have been looking is we have been thinking like it is idiopathic. Okay. Conventionally, we believe that still that BP is idiopathic. Idiopathic is a term like if you don't know, we coin the term idiopathic, which means we don't know the answers, but we have a lot of drugs for this, for reducing the BP. Okay. It is not at all scientific, right? We don't know the roots of the disease, but we are treating it. Right? And we do think that BP is a disease of old age. Absolute nonsense, absolute garbage. And it's people believe that salt causes rise in BP. Again, it's not completely true. And we are using a lot of drugs to control the BP. Okay, right? But we don't know why the BP is happening in the first place. That's why we are calling it is essential. It is idiopathic. It cannot be like cured and all those things, right? But if you know that the elasticity of the vessels is most important, the rheology of the vessels, I mean the fluids is important, the quality of the fluids is important in the circulatory system, and most importantly, the hyperinsulinemia, the increased insulin level and insulin resistance contributes to rise in BP. If you know this, then you have the cure. If you don't know this one, this pathophysiology well, then you cannot find a solution towards it. Now, all these things happens secondary to increased consumption of ultra-processed foods, that too in the last 50 years time, particularly in the last 40 years time. Is it clear for you so far? Or is it running over your head? Yeah, man is as old as his arteries, right? We all know this. And even at 100 years, people can have a wonderful BP of like 120/80. They can stay at that. It doesn't mean that just because you are getting old, your BP need to become 190 140/90 or 150/90 or 160/100. No, it is not. Okay. You can have your BP at very, very normal level, even at 100 years of age. If you know this science well, if you have a very good lifestyle, food and lifestyle and nutrition part. And the endothelial lining is like 60,000 miles, which means it is like 2.5 times the circumference of the earth. Okay. If you measure the distance of the blood vessels, it is like 60,000 miles. Okay. So if you know the intricacy of the cardiovascular system, and there is a Superman protecting our cardiovascular system, and for this discovery that this nitric oxide is the signaling molecule in the cardiovascular system, the scientist has been awarded Nobel Prize, right? Do you know that nitric oxide is the Superman of the cardiovascular system? It protects the cardiovascular system, it protects the blood vessels, heart, and all the organs. Is it clear for you? And whenever the nitric oxide production is coming down, that's why we are getting this kind of a increased risk of heart attacks and strokes. And particularly, we are having a lot of inflammation during this time in the arteries, in the vessel wall, and a kind of systemic inflammation is also going on during this time. And a lot of cholesterol deposition does happen when the nitric oxide production is coming down. It could be a correlation as such. Okay. So what is Poiseuille's law? What is Poiseuille's law? Anyone? How many of you are physicists or engineers? Anyone here? Anyone? So what needs to be understood is like the resistance inside the vessel. So it is a garden hose. If you would have all used it, and just to have a very great distance, what you used to do is you tend to have a partial blockage. How many of you have done this before? Partially blocking the blood vessels, I mean the hose, just to increase the distance at which it covers for gardening purpose. How many of you have done it? Anyone? It's quite interesting, no, right? Only one of you have done it, no one else. Oh my God. I thought most of you would have been like enjoyed this kind of a gardening, right? Watching the plants. Okay. So what happens here is the resistance is actually inversely proportional to the fourth power of radius, which means the radius of the vessel wall is having a very great impact over the resistance and hence the pressure. And hence the pressure inside the lumen increases, inside the hose increases, and it propels the fluid at a very great force. And this is the reason why we are having increased BP whenever you are having not a very good dilatation inside the blood vessel. We will discuss this now. Just remember that the resistance inside the vessel or else the pressure inside the system is inversely proportional to the fourth power of radius. It's most important. Do you understand this? Right? Okay, we will discuss this. We'll be happy to deal with these kinds of a clinical discussion pertinent to this Poiseuille's law. Okay, and many of you are advising our patients to restrict their salt. Whenever the people are having BP, restrict your salt, nothing else. No, it's not true actually. So all these journals, recent researchers have shown that consuming a low sodium diet can be unhealthy. Okay, because it is going to impact the renin-angiotensin system, your total cholesterol and LDL cholesterol, and people may be having a greater risk of cardiovascular diseases if you are following the low salt diet. You could clearly see in this picture here that following a like low sodium diet here, less than 2 grams, they're having like increased risk of heart attacks and strokes. Do you see that? And when people are having like 4 to 5 grams or 4 to 6 grams, it's absolutely fine. And even increasing the salt intake is not going to have a very great impact, right? Compared to that of a very low sodium intake. Because we have been consuming a lot of salt prior to the refrigeration era. You know what is the thing that is being used for food preservation prior to refrigeration era? Anyone? Particularly the animal foods and all those foods. What is the preservative used? Anyone? Great, salt. Salt is the preservative. Was the preservative used? And during those time, no people suffer from like increased BP, right? So there is a clear disconnect between the salt and the BP. You will know that salt is also correlated to hypertension, but in a different way, but it not in a way like we are thinking. Okay. And the term salary, solvation, and then solute all comes from the term salt. So people respected salt, and it was like gold in those days, in those ancient days. That is what we need to understand, and we need to respect the salt. Okay, we should not demonize the salt just because it has been wrongly depicted as the villain and a causative factor for hypertension. It is not. Okay, so is it understandable for you what I'm telling? So what we have picked is the wrong white crystal. It is not the salt that is causing the high BP, but rather it is the sugars, okay, that is causing high BP by stimulating your sympathetic activity and sympathetic tone, increasing the high insulin level, increasing the insulin level, leptin, and fructose forms a dangerous molecule called methyl glyoxal, which is very much destructive to your vascular system, and decreases the nitric oxide, increases the free radicals, and all these things happens, finally producing increased BP. Is it clear for you now? Is it clear? Yes. Okay. So what needs to be understood is like whenever you are having high insulin levels, okay, the insulin have a very specific property when it is in high levels, like it will retain sodium and water. It will retain sodium and water, and it will cause anti-natriuresis. It will retain sodium, and whenever the sodium is retained, then water is also retained. You all know this, right? And it increases the blood volume, and increased blood volume increases the systolic pressure. And uric acid actually is increased in high insulin levels because insulin tend to have some kind of action like anti-uricosuric action, right? And increased uric acid actually causes endothelial dysfunction, and this decreases nitric oxide. You all know this. And what happens when the nitric oxide production is decreased? Anyone? Firstly, we need to understand that as the volume increases in insulin resistance because of increased sodium and water retention, then what happens? The pressure automatically rises. You all know this, right? Is it understandable for you? Increasing the blood volume increases the pressure just because the volume is increasing now, right? Okay, great. So whenever what is happening here, whenever there is decreased nitric oxide production, when there is increased nitric oxide production, what happens in a blood vessel is diastole is like partial contraction, okay? Yeah, state of partial contraction. It's not fully collapsing. The blood vessels is not fully collapsing inside your system. It's partially collapsing, okay? Partially contracting state. And it is fully expanding during systole, partially contracting during diastole. What happens when you're having decreased nitric oxide production? We all know this nitric oxide is what is producing the relaxation of blood vessels, okay? And that's why we are calling nitric oxide as the blood vessel relaxing factor. It relaxes wonderfully. And it is a magic molecule that is secreted by all these endothelial cells inside our blood vessels. So it just relaxes your arteries just freely so that the vessel will expand beautifully. Okay. But whenever there is vascular and insulin resistance, what happens now? The nitric oxide production will come down, and hence, as you are using the hose inside the Gordon, right? The Gordon hose, what happens now? Because of this partial contraction, the blood pressure increases. Is it understandable for you now? The reason why we are having this kind of a increased BP, is it understandable for you? Right? So the state of partial contraction, it's happening whenever there is decreased nitric oxide production, just like this. Okay, that's why we are having increased BP, nothing else. It's not even like idiopathic essential. No, it's not age related. Okay. And one other factor is what we need to understand is high insulin levels that's seen in hyperinsulinemia. I mean, insulin resistance causes excess sodium retention or water retention. That's why we are expanding the fluid like this. And this expansion of the blood volume also increases the blood pressure. How many of you understood this concept? There are two things that needs to be understood clearly. Okay, these are very basic ideas. And another thing is like decreased magnesium. Okay, magnesium is also a very good, wonderful relaxing factor. Magnesium and potassium, which is often found in plants, right? And just because we are not having a fiber-rich diets, a lot of like 5 to 6 cups of vegetables and green leafy vegetables every day, we tend to have decreased potassium and also magnesium, and this also causes imbalance in the sodium levels inside our body. Okay, so these are three main things that contributes to blood pressure, and also the increased uric acid production seen in insulin resistance. So now, can we actually reverse this thing? Having known all these things, is it possible for us to reverse the BP? Yes, we feel as type S in the chat box. Having known all these things, can we reverse the BP? Can we reverse the hypertension? Can we reverse the high BP to normalcy? Yes, we can reverse, because we know this problem, right? We know the problem and we have the solution. Of course, we have the solution. Okay. So what we need to understand now is, when you are taking a lot of medications for BP, what we are doing is we are reducing the perfusion pressure, doing nothing else. We are stopping the heart from beating normally, okay? And we are actually doing, by using a lot of beta blockers, alpha blockers, we are actually breaking the system, okay? The autonomic nervous system, the renin-angiotensin system, everything is like blocked. Even the calcium channel blockers, see, the normal response is not at all produced because of the feedback is not happening. Okay, the body is so much intricate that our body depends on the feedback. Okay, every now and then, whenever you are taking all these medications, what happens is we don't have a feedback. Our body just runs in like a constant machine motion. Then what happens now? You tend to develop a lot of diseases just because you had a lot of drugs. Okay, and these are some of the drugs that is used for every pill, because following every drugs, you tend to have a disease, and for those diseases we tend to use a lot of pills. So it's a never-ending story of beating around the bush. And the thing is, what we need to understand here is, just by simply knowing the facts, ideas, and the knowledge could be could be the best medicine. Okay, it's not the drugs, but rather the knowledge that could be the best medicine. And the best doctor use the least medicine. You all know that, right? Another important thing, now we have discussed about BP. That's wonderful, and I hope you all understood this. Now we shift our focus towards cholesterol levels. How many of you understand what is cholesterol? Anyone? Anyone knows what cholesterol is? Yes? Anyone knows what cholesterol is? Because whenever we say cholesterol, what we feel is like we are scaremongered, right? We are just moving into sympathetic dominant mode whenever you are like feeling like someone is telling cholesterol. We are scaremonger to the core that the cholesterol word is becoming a bad word in medicine. How many of you understood this? So in 1960s, people were actually decoding what is the cause for heart disease, because in the last in the 1940s and 50s there is increased incidence of heart attacks and strokes, not because of increased fat intake, but rather it was due to increased smoking and all those bad dietary habits and the increased use of refined oils. But rather what happened is, because of large influence of the drug industry and the food industry, they have demonized the fat to be the cause of heart disease and strokes. Okay, so in the 1960s, it all started with the gentleman called Ansel Keys. He wrongly depicted the fat as the cause of heart disease. That we all know that what we call diet heart hypothesis. Can anyone tell what is diet heart hypothesis? Anyone? Diet heart hypothesis. It's nothing but whenever you are taking a lot of saturated fat inside you, what happens is there is increased in cholesterol, and this increase in cholesterol can be linked with heart disease. So two statements linked together, and this is what we call diet heart hypothesis. Increasing fat intake increases heart disease. Okay, and the single notion about fat is actually the greatest scam of the century in medicine ever. Okay, because it has killed most of the things than what is being killed by a lot of wars. Okay, this simple misunderstanding has led to a lot of complications now. That's why we are suffering from all these chronic disorders, including blood pressure, diabetes, cholesterol, heart disease, and all those things, right? So 1984, what people thought was we are giving dietary guidelines depicting that cholesterol now as the bad news and fat is not good for you, and all those things were happening. And people started to switch over from fats to unrefined carbohydrates. That's another problem, right? And nowadays, thankfully, in 2014, it has been published that eat butter, and scientists got it wrong, and we need to change a lot now. Okay, we need to move towards saturated fats and away from all this ultra processed carbs and ultra processed oils like refined oils and PUFA. Is it clear for you? And the most important thing is there's a big drama happening now. Okay, whenever people are, what you tend to look at the lipid profile. Like whenever you are having cholesterol numbers in your hands, what is most likely given the importance? Is it HDL, triglycerides, or LDL cholesterol? What we need to look at most often? Anyone? We tend to look at only the total cholesterol and also the LDL cholesterol. That is the least important thing that we need to look for. Okay, that's why we are suffering from heart attacks and strokes. Even when you are reducing the cholesterol, like more than 50%, more than 75%. So all this big pharma industry and the food industry and the nearly 100% of all the cardiologists and the American Heart Association, American Medical Association, and the American cardiologists, all these things believe that having ultra processed carbohydrates, using a lot of statins, PCSK9 inhibitors, and decreasing the LDL level to near zero can reduce your heart attacks and strokes. Is it so? Is it so? Are we successful in doing it just because you have decreased the cholesterol, the LDL to near zero? Never, no. So we have been waging a war in the wrong direction, right? And we have been suffering a lot. The heart attacks and strokes keeps on increasing. It's not in the decreasing trend even, right? So which means we are not addressing the root cause, but rather we are addressing something else. That's why we are suffering, continue to suffer, right? And there is, you all know this, this could be the greatest deception of all time. And all these trials, so whatever I am talking here is fully scientific, okay? Whatever is given in the recent research papers, I've gone through all those things and connected the dots, okay? Nothing else. It's not my idea, but the ideas of so many greatest scientists of all time. And what need to be understood is here, you could clearly see in all these trials, people reduce the LDL cholesterol, right? To a percentage about like 25 to 60%. But what happened to the mortality benefit that we are getting here? In the 1990s, it's like mortality benefit was like 3.3. And nowadays, because of the strict guidelines and protocols, what has happened is that 3.3 has reduced to drop to 0% or 0.5%, 0.1%. How small it is, right? Decreasing your cholesterol, I mean the LDL cholesterol of 50% is producing only a decrease in mortality benefit of about having like 0.5%, which means these are like only correlating factors. These are not causative factors. How many of you understood this concept? Decreasing your LDL is not going to have a very good mortality benefit. And there is a term called statinization of the entire population to prevent the heart attacks and strokes. Okay, how unscientific it is. Just simply look at these numbers. Decreasing your LDL cannot produce a mortality, I mean benefit in the mortality rate, cannot decrease your mortality by any means. Okay, it's like near 0% increase. But why we are always advised to take statins? Because the drug industry depicts the relative risk reduction, not the absolute risk reduction. The absolute risk reduction is like 1 to 2%, but the relative risk reduction, that what you have been told is like 30%, 40% reduction in heart attacks and strokes and further events. That's why you are taking drugs. But whenever the truth is told, you will never take the drugs. Okay. What we need to understand is the absolute truth, absolute risk reduction, not the relative risk reduction. Okay. Just because of using this relative risk reduction, all these drug companies are making a lot of money, producing a lot of side effects, and we are still suffering from it. What we need to understand is we know the absolute risk reduction, which is less than 1% in most of the drugs, like particularly statins. Okay. Is it understandable for you? Clear? And you all know this, just waging a war against LDL cholesterol, we are actually losing, the loser's side. Okay, the losing side. You all know this because there is a law in medicine. Whenever you are not understanding the disease and treating it in a wrong way, what happens? Epidemics still persists. That's why we are having an increasing trend in the heart attacks and strokes in the last 30 to 40 years. There has been never a decreasing trend because we have been treating it wrong. Okay. And this is by clear science, nothing else. Okay. Epidemics persist only as long as the genuine cause of a disease, genuine cause of the disease is not understood. We understood it to be like total cholesterol, LDL cholesterol, absolute garbage. It's not. And therefore, no specific and preventative and therapeutic measures can be developed. That's why we have like increased heart attacks and strokes even occurring in the like 20 years, 30 years, right? Even the middle-aged persons are dropping dead nowadays just because we don't understand the science. What we need to understand here is the notion about cholesterol. It's need to be changed. Okay, the cholesterol is a wonderful molecule that we need to understand that our liver makes. If cholesterol is the villain, that why our liver makes about like 2 to 3 grams of cholesterol every day. Even if you are not taking any sort of cholesterol, the liver makes it. Okay, it carries the passengers. I mean, if you like want a metaphor, what we can tell us like the cholesterol is like the The LDL particle, what we believe is here can be like, it's like boat, okay? LDL particle. What is carried inside this LDL particle is like passengers, that is triglycerides. And it also carries always the life rafts, right? It is like cholesterol, okay? So the main function of this LDL particles and all this VLDL, LDL and all those particles is mainly the energy model. That means it is more and more involved in delivering the fats for all the cells inside our system. Okay, is it clear for you? And the secondary role is carrying the cholesterol. It's like for rejuvenation and repairing the damaged molecules using cholesterol. You all know this, right? Is it understandable for you? Okay. So this gentleman had already told in the 1970s and 80s, like in all the heart disease, there is an important factor called insulin resistance. Okay. Without insulin resistance, most of the heart attacks cannot happen. Okay. So much intricate and or these insulin resistance and cardiovascular diseases. And he even told to the core, like those with cardiovascular disease not identified with diabetes are simply undiagnosed, which means diabetes in the sense like it's not only increased sugars, but also the diabetes in situ or what we call pre-diabetes or increased insulin levels or insulin resistance, both together. Okay, is it understandable for you now? And this was actually proven again and again by this EuroAspire study published in 2015. And you all know this, that whenever you are taking a proportion of population who have been suffering from heart disease, what we know is a percentage of population, like 30% of the population are non-diabetics, okay, or non-diabetics. When we are taking the rest 70% that are non-diabetic CAD victims, what people found out was when they are done rigorous testing like the fasting levels, the postprandial levels, the OGTT testing, and all those things, people found out more of the non-diabetic, non-diabetics are actually becoming diabetic. Okay, they are not simply diagnosed. And the rest of population were having normal glucose levels. But when the rest of the population is like again tested for insulin resistance and insulin levels, all this population have been suffering from insulin resistance. So the cardiovascular diseases and insulin resistance are terrible twins. Do you understand this concept? If you don't understand this one, we cannot prevent heart disease, strokes, heart attacks. It is not at all possible. Is it understandable for you that increased insulin levels and insulin resistance is the cause for cardiovascular diseases, nothing else? Is it understandable for you? Yes? Is it clear for you? Great. So you need to know the terrible twins, right? Cardiovascular diseases and insulin resistance both go hand in hand. Okay. Now, how to find out if anyone is suffering from insulin resistance? We will discuss this one in a short while. And what we need to understand is whenever someone is suffering from erectile dysfunction, which means that men cannot raise their flag, we need to understand this, a red alarm that he may suffer from heart attacks and strokes in the next 5 to 10 years of time. There is increased risk because 80% of the cardiovascular events in patients have actually prior history of erectile dysfunction. This is what we need to understand. And even people in the early 30s and late 30s are suffering from erectile dysfunction nowadays. And this erectile dysfunction can be easily reversed when you're reversing this insulin resistance, right? You all know this, right? Erection happens just because of increased pooling of blood in the genitalia, right? You all know this, right? In the spongy version, is it not? You all know this. And whenever there is decreased nitric oxide production, what happens? As in insulin resistance, then the vessels will shrink, it will not expand, it will not dilate. That's why the people are suffering from erectile dysfunction. It is not due to psychological, it's not due to diabetic, but rather due to insulin resistance and decreased nitric oxide production that causes erectile dysfunction. How many of you understand this concept? Anyone? All of you? Okay. So maybe like 50 years, 100 years ago, people used to carry this kind of a cannery along with them when they are doing mine works. Okay, when they are going for coal mines. Can anyone tell why they carried the cannery in the coal mine? Anyone? There is a scientific fact behind this. Anyone? So the cannery is like, it is so much sensitive for the poisonous gases like methane and all those poisonous gases, carbon monoxide and all those poisonous gases, that the threshold is so low for these canneries to die. And when people are constantly looking at the canneries, because it cannot be detected easily, right? In the maybe like 50 years, 100 years ago. So what has happened is, like, whenever the cannery is like is dead, which means like a lot of poisonous gas is leaking, right? And the people like they will shift towards like, this is an important thing that we need to understand here is, whenever the cannery is like dying, which means there is increased risk of poisonous gas release or already released, like carbon monoxide and methane are already released, and people are at risk of death. So people will suddenly escape now. So the cannery is like the erectile dysfunction can be compared to that of a cannery in the coal mine. Is it understandable for you? Which means like people with erectile dysfunction are at the like verge of developing heart disease and strokes in the next 5 to 10 years of time. How many of you understood this concept? Understood? Yes? Great. And most important thing is, why it is so? Because the penile artery is so small, like having a diameter of like 1 to 2 mm. So whenever the plaque is getting, the plaque is getting deposited, or else most of the nitric oxide production is coming down, the penile arteries are the one that is going to be affected first, right? Followed by heart attacks, chest pain, and strokes. Is it clear for you why the ED is occurring first prior to heart disease, heart attacks, and strokes? Is it understandable for you? Not only plaques, but also the most importantly, nitric oxide production. That is nitric oxide production, which is decreased whenever we are having increased vascular resistance, insulin resistance. Is it understandable for you? Okay. So what has happened in the last 40 to 50 years is we are becoming more and more insulin resistant. We are becoming more and more insulin resistant just because we have shifted our lifestyle from normal food, real food, to ultra processed foods, like increased sugars, increased refined oils, and a bad combination of high fat and high carbohydrates at the same time, right? All these things have screwed up our hormone system, particularly the insulin levels. Okay, that's why we are developing increased abdominal obesity. People nowadays is like 75% of our entire population is suffering from this kind of insulin resistance, at least. Okay, and people are having this kinds of insulin resistance, high insulin levels. That is the reason for all the cardiovascular disorders. Okay, and we are not more no more a normal human species, but we are like modified one. Okay, hormonally modified man, just like genetically modified species, we are hormonally modified man, and we need to shift towards normalcy by switching over to real food. This could be the permanent solution to this cardiovascular diseases. So what we need to understand here is like erectile dysfunction happens first most often, followed by heart attacks and strokes, and leg pain also occurs when there is something like atherosclerotic plaques occurring. I mean, obstructing the large vessels inside the aorta or the branches of the aorta, and particularly the iliac arteries and the femoral arteries. So people tend to experience this kind of a chronic pain, right? When there is atherosclerotic plaque, that too in the advanced stages. And all this can be completely preventable, but most of the tertiary cares and all those things are focusing on all this high-tech technologies are focusing only in the dealing with the complications. Okay, they're not actually dealing with the root cause. When you are finding the root cause, it can be easily preventable, it can be easily curable, it can be still reversible. But we are not, our focus is like only in dealing with the complications, that too in vain. Is it understandable for you? So this is what we call claudication, right? Claudicatory pain or claudication, right? And whenever people are walking for a long distance, people may feel a kind of pain like this, and people will rest, and after some time they will again go to work. And this claudicatory distance comes down like drastically from 200 meters, 100 meters, 50 meters, and they are incapacitated finally. Okay, this is what we call claudicatory pain, right? Due to atherosclerotic plaques. And how to know whether someone is insulin resistant or not? It's so simple, okay? By understanding the science. You don't have to measure your like insulin level, fasting insulin level, because it is not possible at each nook and corner of our country, but rather look at these simple signs: increased skin tags around the neck, in the back, and particularly the blackish discoloration or the face, underarms, around the neck. Sadly, it is being seen even in children nowadays. Okay, it's a red flag sign that you are suffering from these disorders, and you are supposed to develop all these chronic diseases like increased BP, sugar, cholesterol, heart disease, strokes in another 5 to 10 years of time if it is not addressed in a proper way, right? Is it clear for you? And particularly in women, this kind of androgenic alopecia and acne, all these things are red flags that you have like high insulin inside your system. This high insulin level causes all this skin signs. Okay, whenever you are having skin signs, you need to be treated. When you are finding your family members and friends with these skin signs, they need to be treated, and all these signs will disappear within some weeks time, maybe like within a month or two. All these signs will disappear. How many of you understand this? You can get rid of insulin resistance easily, but the science is actually missing here in conventional science, sadly. Okay, and this is what we call lipotoxicity. So many of you would have noticed the diagnosis of fatty liver, most of you. And interestingly, what has happened is we just pacify who is getting fatty liver, and fatty liver is now becoming a new normal. Everyone is suffering, and we are giving a false assurance that fatty liver is nothing more, just reduce the fat. Absolute garbage. Okay, the fatty liver is due to the high insulin levels and due to high like intake of simple sugars. Okay, and this is what is producing the fatty liver. It's not like due to the increased intake of fats, and refined or consuming a lot of refined oils increases the fatty liver, and increased saturated fat intake actually decreases the risk of fatty liver, right? But we are actually dealing in the opposite direction. And the fatty liver is nothing but a silent scream from the liver, like lipotoxicity. The spillover happens everywhere. Spillover happens everywhere inside the system, that too in the heart, inside the vessels of the heart. And that is what is triggering all this ischemic heart disease. Okay. And how can we diagnose a person with insulin resistance? Fasting insulin level more than 6. And whenever this another surrogate marker for insulin resistance, your dyslipidemia or triglyceride HDL ratio. Whenever the triglyceride HDL ratio is more than 1.5, okay, anyone having your triglyceride HDL levels in your hands, you are fasting, lipid profile beside you, anyone? So do remember this, like whenever the triglyceride HDL ratio is more than 1.5 and VLDL is more than 1.5, there is ectopic fat deposition happening inside your system, and this will cause a lot damage to your system. Okay. And atherosclerotic plaques or inflammatory lesions elicited by the ectopic fat. So the ectopic fat deposition inside the vessel walls and inside the heart and inside every organ, it will produce a kind of inflammation. Ectopic fat is always accompanied by inflammation, and this inflammation causes atherosclerotic plaques. Is it clear for you now? And LDL cholesterol, as you all know, it's for repair and regeneration, and these inflammatory lesions causes damage to the vessel walls and the cells. And to correct this damage, our friend cholesterol comes in, and we usually tag this friend as the villain. Okay. How bad it is. That is the way we are treating cholesterol nowadays. We are treating heart disease nowadays. That's why we don't have a solution as of now. Okay. And another thing is, we have a Superman. We have already told you that nitric oxide production is a magic molecule that is being like secreted by the cardiovascular system. It protects against heart attacks. Okay. And whenever you are having insulin resistance, you have decreased nitric oxide production and have increased risk of heart attacks and strokes. Is it understandable for you? Okay. Another most important thing that we need to understand is not the LDL that is the primary contributor to the atherosclerotic plaques, but rather the lipoprotein A, lipoprotein LP little a. Because actually the researchers had actually missed to look for this ApoA and therefore came to the wrong conclusion that LDL causes atherosclerotic plaques. It is not, it is rather the Apo lipoprotein little a. Okay. And with the insulin resistance, I have already told you the terrible twins, that is the insulin resistance and the cardiovascular diseases, right? Whenever there is insulin resistance, there is decreased nitric oxide production. It's again a prothrombotic state. Insulin resistance itself is a prothrombotic state. You all know this. That is particularly prone for developing thrombosis. That is what we call prothrombotic states. And what is happening when there is insulin resistance? Lipid spillover will occur. Okay, I have already told you that this kind of a spillover occurs whenever you are having insulin resistance and fatty liver and lipotoxicity. So the lipid spillover will occur if you like your entire blood vessels, entire body, in which all these fats are getting deposited inside your heart, inside the blood vessels, inside your liver, inside the pancreas, inside the viscera, right? Whenever there is ectopic fat deposition, there is inflammation happening, and this inflammation, to solve this inflammation, there is one molecule called cholesterol that comes into play. That is what we call cholesterol rescue. This is just a correlation that whenever there is inflammatory lesions, whenever there is damage to the vessel wall, there is cholesterol. Doesn't mean that cholesterol causes atherosclerotic plaque. How many of you understand this concept? So it's a rescuer, right? It's like a firefighter. We have like tagged to be the demon, to be the villain. It is not. Okay. Is it understandable for you? And whenever you are having like micronutrient deficiency and vitamin C deficiency, you tend to have a like weaker plaques that is prone to rupture, and this will trigger the heart attack. This will cause the heart attacks. Okay. This is a new concept developed by me, and this one works wonderfully well because most of the patients treated by me are not at all suffering from this increased risk of cholesterol and heart attacks and strokes. Okay, you can very easily solve this problem when you know the when you define the problem what it is. And you all know this, that all the animals do not suffer from heart attacks. Why? Anyone? Animals do not suffer from heart attacks, but rather humans. Why? Is it a curse for the humans? No, it is definitely not, I would say. But rather, we need to understand a little more things. Why animals are not suffering from heart attacks? Anyone? Yes? Diet is different rather than anything else. So there is one important thing that we need to understand is animals produce vitamin C, but humans cannot produce vitamin C. Okay, and vitamin C actually helps in production of collagen, and this collagen production like stabilizes all these inflammatory lesions. Okay, and because of the inability, lost potential to produce vitamin C, synthesis vitamin C of our cells, we are at increased risk of heart attacks and stroke nowadays. And LP little a has taken the role of vitamin C nowadays, and it is actually partial. That's why we are developing atherosclerotic plaques. Right? That's why we are suffering from atherosclerosis and all those plaque. Is it clear for you now? And lipoprotein LP little a is a repair molecule that for the vitamin deficient artery wall, and anywhere between 500 to 1000 milligrams can be taken easily without any side effects. Vitamin C particularly. That too in natural form is wonderful, but also you can take in pills, that is also fine. And you know to understand that the ApoA is a substitute for collagen in the vascular wall whenever it is injured or structurally impaired. Just because animals are producing all day long throughout their lifetime, that don't suffer from this kind of a structural or injury to the endothelium or the cells. It is easily repaired by this vitamin C, which is we have lost the ability to synthesis vitamin C, and that is the reason why we are suffering from this atherosclerosis, particularly the human race. And the lipoprotein little a is like demonized everywhere. If LDL is bad, but then LP little a is worse. That is what we believe. But the thing is, LP little a has tools to handle all these things wonderfully well, that it is actually a protector for our health, but rather it has been demonized nowadays. And just because of the cholesterol is found everywhere whenever there is atherosclerotic plaque, we have been wrongly thinking that cholesterol causes those plaques. It is not. It has come to the rescue. Okay, and we have been using a lot of statins and all those things to decrease the cholesterol. It is going in the wrong way, right? Is it clear for you now? Is it clear for you now? Right? Yeah. So the heart attacks occurred due to rupture of the fresh volatile plaques. Okay, it is not due to the old fibrous calcified scars that is causing the heart attacks and strokes, but rather the rupture of a fresh volatile plaques. We will understand this in the following slide. You can very well clearly see here that there are two things. One is stable plaque and vulnerable plaque. The stable plaques are what we see in the angiogram, CT angiogram. We used to see only the stable plaques, okay, that are fibrous, slowly occlusive, that are stenotic, that can cause angina. That is fine, but it is not a very good contributor like to the heart attacks, acute coronary syndrome, right? But rather it is due to the vulnerable plaques. It is very small, but it is thin capped and it ruptures easily. Okay, and they are typically non-stenotic or not at all detectable during all sorts of CT angiogram. Okay, and this is the major contributor towards the unstable angina and heart attacks and even strokes. Is it clear for you now? We have been dealing a lot of things like doing angioplasty, bypass, and all those things, addressing the stable plaques. which are not at all a dangerous one, but rather the vulnerable plaques which goes undetected all the time, which is the cause for acute coronary syndromes, which is the major contributor to the deaths. It's the vulnerable plaques. It's not the stable plaque. But we have been treating only the stable plaques, not the vulnerable plaques. Is it clear for you now? Rupture from a vulnerable plaque is the reason for most heart attacks. Okay, because heart attacks it can occur in seconds, within minutes. Within minutes it can occur. Okay, and heart attack is nothing but a coronary artery thrombosis that causes infarction. Okay, dying tissues because of lost blood supply. And this plaque is actually small and even unseen, even with CT scan or angiogram. Is it clear for you now? Is it clear for you now? Another thing is what we have been doing with angioplasty and bypass is unscientific, because you all know this. Many of you know, like seen this kind of an angiogram report, that there is something like triple vessel disease or quadruple vessel disease, something like 95%, 99% blockage in the coronaries. Is it killing us? Is it killing us? Do we believe that those plaques are killing us? Anyone? No, definitely not. But how the people have survived over a period of years, it has not happened within a day or two, but rather it has happened over a period of 10 years, 20 years time. Okay. It has happened over a period of 10 years, 20 years time. It has not happened like over like one day or 1 week, but rather 10 to 20 years or more than that. Okay. And whenever there is obstruction in the coronary vessels, what happens there is, God has given a wonderful bypass circulation. Okay, this is what we call natural bypass. Okay, bypassing the obstructed coronary vessels. Okay, that's why people survive even with 95%, 99% blockages. How many of you understand this concept? Yes? How many of you understand this concept? Just because of the wonderful collateral circulation, okay, collateral circulation or a natural bypass that is happening inside the vessels of the heart, we are surviving. Okay, how many of you understand this? And studies done over a period of time, like veteran, European, and case study, all those things, what they usually repeatedly told us is there is no need to go for the bypass surgeries when you are giving a very good medical care. Okay, there is not much of a difference between the survival rate between medical and surgical. You all know this, right? At great financial cost, we suffer from a lot of pain and sufferings and the risk of complications, also death, when you're going for bypass surgeries rather than going for optimal medical therapy. And angioplasty also have no benefit unless it is like done in the very first 3 hours of time. Okay, so angioplasty lacks benefit when it is done more than 3 hours of presentation. And more 95% of the time, people reach the hospital at a very late time, like more than 6 hours, more than 2 to 3 days time, they are reaching the hospital. By that time, the thrombosis is already stabilized and nothing can be done about it. And the infarct cannot be revived now, right? You all know this, right? So angioplasty doesn't play a role, but rather what we're taking with angioplasty is just like the old stable plaques, which is not the risk for heart attacks. Okay, we are treating it wrong. Okay, and yes, of course, there is a role for angioplasty as an emergency procedure. Okay, with sudden closure of vessels, actually people benefit from angioplasty when they are treated within 90 minutes of time. Okay, for the purpose of reperfusion, nothing else. Is it clear for you? And this could be a little hard to understand for you because What we are doing in conventional science is just the opposite way. And is it possible for my arteries to heal? I have already developed atherosclerotic plaque. There is something like 95%, 99% clogs inside my arteries. Is it possible for me to reverse this condition? Yes, absolutely possible. If you stop the repetitive injuries from your fork and spoon, particularly the ultra-processed foods and high insulin level, when you are stopping this high insulin levels and insulin resistance, you can reverse all these blocks, okay? And you have to stop smoking and alcoholism. When you are doing this, you have the excellent healing capacity, right? And there will be wonderful production of nitric oxide, which will reduce your and eliminate all this chest pain, and you can heal well. Is it understandable? Yes. So the approach to the heart disease is just like to heal the arteries, we can open the lumen, stop the chest pain, and prevent a heart disease and prolong life by eating a real food. Okay. By following the low insulin diet, not the ultra processed foods, high in sugars, high in refined oils, high in refined fats, high in refined carbs. Okay. And you can take baby aspirin like a 30 milligrams per day till the reversal of the atherosclerotic plaques. Okay. Nothing else can be needed. And you have to be pretty much clear about the exercise. You should not be doing rigorous exercise when you're having pain. So you have to go for ordinary exercises, regular walking and all those things, and make sure you are doing exercise without causing chest pain, because you are already having decreased cardiac reserve, is it not? And sudden onset of chest pain, significant chest pain, requires immediate intervention. At least medical therapy should be is most required when it is, and particularly within 6 hours of time. All these diseases can be completely reversible. Okay, is it understandable for you now? What we can expect in our patients is like complete reversal of hypertension. This gentleman had hypertension of about 210, 130, which has been reduced to 130, 70 within 2 weeks time, just because we have understood the science behind the blood pressure. Okay, and he is doing wonderful well, and he's still having the normal BP for another, now, it is almost like 2 years we have reversed this hypertension, and he is doing wonderfully well. And this is what we can expect, like reversal of dyslipidemia or high cholesterol. You can clearly see that the cholesterol numbers, particularly the triglycerides, are like in the range of 500, which has been reduced to 177 within a span of 2 months' time without using any drugs, no drugs. Okay. And he is in the reversal phase that he will reduce his numbers less than 100 in another month's time. That is what we are expecting. That is what we are seeing in our patients. Rapid reversal of this atherogenic lipid profile. Okay. And to my knowledge, no person should suffer from heart attacks and strokes. No person. Having the right knowledge about food and nutrition, and also regarding the disorders. Okay. And we also deal with this reversal of this increased blood sugar levels. We hold the world's fastest diabetes reversal, which has happened within a span of 4 days. And in the gentleman, a 70-year-old farmer has reversed his high blood sugar numbers from 350 and 500 down to 100 within a span of 7 days without using any drugs. This was possible with understanding the science, and most of the chronic disorders can be reversed when you understand the science within a span of about 3 to 6 months' time, and you can live without drugs and lead a disease-free life when you know the science. And knowledge could be the right medicine for you. So what we need to understand now is, so he is the pioneer of heart transplant surgery. He is the one who was first to do the heart transplant surgery, Christian Barnard, right? Who has saved at least 150 people by heart transplants during his lifetime. But he himself told during the later days that if I had focused on preventative care medicine earlier, I might have saved 150 millions. Okay. I might have saved 150 millions, and cash should be given towards this preventative care and reversal of the disease rather than controlling the disease and dealing with a lot of complications, right? Is it understandable for you? Yes. Hope you enjoyed this session. Now, what we need to know is, whenever there is time, you can look into our website. Is it clear for you now? Yes. Is it clear for you? I need some answers from you. Yes. So Dr. Gold.in, okay? drgold.in. Kindly note it down. And so in this website, I have published almost like all the researchers, right? The concise report of the researchers. What is the real cause of like all these diseases, PCOS, infertility, fatty liver, blood BP, cholesterol, heart disease, obesity, everything is being dissected to the core. Like we can address all these disorders without using any drugs, have knowing the correct pathophysiology, why it is occurring. Okay, so you can look at all these things and have an idea why it is happening, and we can have even a cure for all the gastrointestinal diseases, disorders, and autism also. Okay. And what we need to understand here is about the science. We have already done something around 2000 reversals so far successfully, and the people are leading a disease-free and drug-free life. Okay. And these are some of our success stories. Whenever you have time, you can look at these things. Everything is dissected scientifically. And we have a very good team, like holistic care, providing a holistic care, doctors, health educators, nurse, staff nurse, and integrative nutritionist, yoga therapist, and you will be giving a holistic care, but at the cutting edge of science. Okay. And you all know this, like we have a comprehensive blood group panel, and we also include the fasting protocols. We have a lot of wonderful scientific lecture series and expert yoga and exercise live sessions when you are enrolled in our program. And this program is like for 6 months and 1 year. If you want, you can like enroll in our program directly. You can choose the date and time of consultation even. And this 6 months plan is like for like reversal, and we'll be guiding you throughout. And it includes lecture series and live Q&A sessions and a personalized dietary plan and continuous WhatsApp support, including support from our wellness team and yoga and exercise live sessions. And the 25,000 scheme is like for reversal and remission plan, in which we'll be giving continuous support throughout the year. And for example, if you want to like buy this plan, you can like type in your name, your number, your email ID, and you can even choose the like the date and time. Like, so say for example, today, maybe by 12:30, like 2 o'clock, I can like schedule my consultation, right? Just proceed with this. And you can write, note it down, these numbers. That is like I will share in the chat box. These 2 numbers, you can like, if you want to have consultation, you can note down the numbers and contact us. This is 1 number. And another one is like whenever you feel like having consultation, you can share it with your friends and families and let them have a disease-free and drug-free life, right? Is it fine for you? Yes, kindly note, like you can enroll yourself in this program. Note down the website. We will Dr. Gold.in. You can enroll yourself on our time. Our team will be able to guide you. Okay, this is my website. You can enroll yourself and our team will guide you. And we have like running franchisee for healthcare professionals. We can have a collaboration even. Like we have like a wonderful software. You can feed all your signs, symptoms of the patients and get like ready-made remedies the very first next minute using that software protocols and algorithms. And we also run this academics called Dr. Gold Academics, which is teaching all the healthcare professionals, including doctors and other streams of medicine, and to have a very transformational career curing all these chronic diseases. And it's like a 4-month training program, which includes 3 months online and 1 month clinical program and 2 weeks of intensive training sessions. You'll be spending time with me in Coimbatore in all those 2 weeks, or at least 10 days time, during which we'll be taking care of all those accommodation and food for breakfast, lunch, and dinner. And you'll be surprised to see all these topics, all these diseases: diabetes, obesity, fatty liver, cholesterol, heart disease, hypertension, strokes, peripheral artery disease. And with respect to women's care, like PCOS, infertility, subfertility, menstrual disorders, pregnancy care, particularly anemia, gestation diabetes can be completely cured, and hypertension during pregnancy, and subfertility and erectile dysfunction in men. And for child care health, it is more like we are dealing with all these psychological problems, developmental disorders, including autism, and gastrointestinal disorders. All sorts of gastrointestinal disorders can be completely cured when you are knowing the science right. And we also have like specific protocols for reversing all the autoimmune conditions, including thyroid and rheumatoid, and usually the osteoarthritis and all sorts of painful conditions. And we have like structured the program in such a way, like from week 1 to week 10, we have like exotic topics which are not available in medicine nowadays, conventional science. These are very wonderful topics which are actually research based and evidence based, and these things will be covered like within a span of 3 months time. And every week we'll be providing the recordings of all these sessions, and at the end of the week we'll be having internal discussion, internal assessment for every week, followed by discussion for about 2 hours time, 1.5 hours to 2 hours time. You will be it's a slow learning process. You can improve your knowledge. Even any healthcare professional or even any degree holders can join this program if you want. And we have field visits, including organic farming, and we'll be having healthy dine outs and how to find health at supermarkets and all those things. And you can have a recreational events here in Coimbatore, and it's a complete package. Like you will be learning a lot of things that you haven't learned in your medical school. And now the floor is open for questions. Hope you enjoyed this session well. Now you can unmute yourself and ask your questions. Yes. And we are running this program every month. So if you want to listen the lecture, you can come over here to our program every month. You can refer your friends and families who have been suffering from this kind of heart attacks and strokes and unnecessarily suffering a lot just because of the lack of knowledge in conventional science as of now. Hopefully this will be improving even in conventional science, and hopefully we are proceeding towards the preventative and curative aspects rather than dealing with only the control measures and palliation. And this could be the science of the future, but we are practicing it nowadays in Dr. Gold Healthcare. Any questions? Yes, please kindly unmute yourself and answer.